Welcome to the Living Medicine Podcast, where we talk about ethical medical use of psychedelic psychotherapy, teaching skills, examining the issues, and interviewing interesting people. Now let's start today's show. Hi, everyone. This is Signi, one of your hosts. This is the Living Medicine Podcast, where we talk to clinicians who are training in psychedelic-assisted psychotherapy or ketamine-assisted psychotherapy, or medical or mental health professionals who are just interested in getting into this work and want to hear more about it. Today's topic is on the use of touch, a pretty tricky topic. And why is it tricky? Well, we know that touch can be harmful, both in regular psychotherapy, but also, and maybe even in particular, in psychedelic work, where clients are vulnerable and boundaries should be even more tightly held. At the same time, we also know that appropriate use of touch and other somatic interventions is critical for doing this work well, and you really can't not do it. In fact, sometimes a somatic intervention using touch is the very thing that is necessary in a psychedelic session. So given this complexity, it's a topic we talk about a lot in trainings. At the Living Medicine Institute, we run training cohorts pretty much year-round. And so we have a lot of class discussions on a lot of different topics. And what you're about to hear is an excerpt from a recent class where one of our current cohorts is discussing this very subject. We're using this as an example because we think it's an interesting conversation, and it also gives you a good sense of what these live classes often sound like and the types of discussions that we often have. We intend to continue to have further podcasts on the topic of touch, and it continues to be an evolving conversation in our trainee community, as it should be. One of the modules we teach to our advanced trainees is nuances of the use of touch. We have a video of a role play of how we discuss touch with a client during the preparation phase, with a lot of nuanced specifics about how that conversation should be held and a demonstration of the use of touch. So at this point in the class, this class has just finished watching that video, and we're moving into a discussion about it. The first voice you will hear is my co-facilitator, Dr. Sandy Newis, and you will also hear my voice frequently during this clip, as well as that of some other trainees, which we have used with their permission. So without further ado, let's listen to this clip and we'll touch base at the end.
Just against the take-home messages, don't shy away from it. It's really powerful. And also
Yes.
Don't not do it because you don't know how to do it in the most expert of ways. The biggest issue is consent, placement, pressure, kind of talking it through and managing your own energy as you do.
One other thing that's in that video that you do want to do is the consent to say no. That's just creating a language where the person can just kind of like go like that and know that you can release without having to be a thing. I won't repeat that because it's in the video, but just it's really important because you guys all noticed, a lot of you have experienced when you're in a session, you're caretaking your sitter or your peers, and you're like, I don't want to upset them. Are they bored? Are they annoyed? Are they? So clients do that. They don't want to like upset the therapist or do it wrong or say the wrong thing. So if you've got your hand on their shoulder and it's bothering them, they don't want to, even if they're altered, they're going to feel like so you really have to front load that permission. So if you don't know what I'm talking about, rewatch that video. Don't leave that part out. I won't repeat it, I guess.
Can I add something to that,
Yes.
Signi? So when I talk about the consent, when I talk about touch, because sometimes words escape us when we're on the client side, and I just do a little spiel on how I'm really asking them to not worry about taking care of me, that this is their time. And if they just want to, they don't have to be polite. I make that really clear. So this is not, my ego is at the door. I leave it out there. And so if they just want to move my hand or release that's all well and good. They don't have to say like, could you please remove your hand from my shoulder? Like they can also just be like, that. We can practice that as well, because sometimes the words don't come and don't need to come in that way.
Yeah. I that reminds me, like one helpful phrase that I've said is like, I'm happy if you shrug me off, because that means you're tracking yourself accurately. Like I'm usually
Yeah.
like, good, she's paying attention to what she needs right now. Like I say that kind of thing to the person.
Yeah.
Yeah, I think that's good. Um, there's a piece with distance from the core that's not in the video that Sandy and I usually want to name, which is that obviously there's a lot of this is knowing your client, right? Like some of what we modeled in that video was like being the most careful for people who are coming in with trauma, especially when you don't know them yet and so on. If you've been working with someone for a while and you have a total different rapport with them, then obviously you're going to be able to lean into touching them more spontaneously and all that because you know them and you have that relationship. But when you are bringing someone in from the beginning, you want to model that you're doing all those things carefully. So obviously, like how long you've known them makes a difference in how casual or how like intuitive you get with the touch while still being ethical, right? And you know that they know you well enough that they'll communicate with you correctly about it, so you don't have to worry that that's not happening. So there's a piece there. I wanted to name a gender piece. Some of you, like for those of you who are guys, there's this gendered piece around trauma and touch with women that is layered. That goes for both genders with both genders. It's not a male therapist, female client thing. It goes with all the combinations, but there is statistically a lot more of that. And also, it was surprising to me when I started doing this work. I think I'd be interested, Sandy, in your take on this one too. How many people wanted contact from him as a team member in the room, a male? Yeah, that happened in retreat this Saturday with Maima. Yeah. It's so don't assume that like sometimes the presence of a strong masculine touch is exactly actually what is being wanted, male, female or not, in the client. And so I've had male and female clients where when my husband was brought in with consent, they were really glad that it was like a safe male touch, specifically male. So I think what I want to emphasize is that I said this in the video, touch is a place where like touch is traumatic. People have been traumatized by touch. And also touch is in some ways the ultimate healing thing, especially for very young parts, right? That where touch was their original language, right? And so as long as you are careful and ethical with how you use this, there are people who they would be better off having like a Rick or a Jake than a me, actually. So we work with what we've got, but I just wanted to make sure, I just wanted to name that. Sandy, I don't know, what do you think on that?
Oh, this, like we've all met Maydad, I believe. He's got a capacity to be very masculine, just energetically, and then to really like soften. And so, for the men in the room, but also just energetically to be aware of that, like, that is profound. Like to be both, like have like masculine energy. And again, that may or may not be specifically gendered. Like I have a lot of masculine energy myself. I have to work actually with softness. And that's kind of part of my sort of polarity balancing in my own life is that. But that balancing of like a gentle man, like just don't be afraid of that. Like to have both things be present.
Mm-hmm.
It's really profoundly healing, not just for women, but for men too.
Mm-hmm. Yeah, and this is getting a little more advanced than what we teach in level 1. This is getting a little into level 2. But we also, like, if you are like I'm a female therapist, but if I feel like male touch is needed, I will enroll myself as a male avatar, so to speak, for someone who's in part of their process or a imagined male other. And sometimes that is a huge thing. So just be aware, just saying that. I know that knowing the client well and knowing their history. And so when you're doing consent around touch, you can name these gender pieces as part of that initial preparation conversation. And so what'll happen with those of you who aren't used to doing all this is that the awkwardness in this is not from the client. It's going to come from you guys because you're not used to having these conversations. Like you're going to feel like, oh, I feel weird talking about this in the beginning, but it's important. And it actually goes a long way to rapport. Like a lot of times that first session, that session when you talk about touch and you do all that, like it aligns. All of a sudden, you've got this amazing alliance after that because they're like, whoa, this person is tracking. And also, like, I get to track myself this much. And they're like, so it can be a huge alliance builder just having those initial conversations, period. One of you said this on Saturday. I actually think it was you, Maima, but I've heard a lot. And this was in that sample session video I sent you guys. I think. And we're going to talk about that in a minute. But clients will say that the touch is what tethers them to not feeling like they're spinning out into an out of control or completely lost place. So what happens is most clients want to have a psychedelic experience where they are experiencing non-ordinary things, but they also know that there is a cord, a tether, something back to reality that they can touch into so that they can feel that both are happening and they're not just like going to be gone somewhere, which is just more scary. And so a lot of times the touch, even if it's just this, they will say afterwards, that kept me tethered to knowing that there was someone else with me and I wasn't alone. Because when you go into an altered state, especially with these eye shades on, like just you can feel like all of a sudden you're dying or you're drifting into this existentially scary place, which is the video you guys are going to watch next, by the way, is these fear moments and all that. But this is that a lot of times what they'll do is they will associate the somatic contact with another human as, oh, I am still also in the room. I am still in this room. There is someone accompanying me on this journey, even though I'm the one that's like seeing the things. I have company. And they name that a lot. Now that could be touch anywhere, but a lot of times that is the touch. It's not just touch. You can do that with your voice. I've interviewed a lot of clients about their experience, and a lot of people will also volunteer. Your voice was tethering me, and this is why you don't want to just sit in silence for 40 minutes because they will lose you completely. This is why in the next video, when I talked about like don't let them go too long without some sort of how are you doing? Are you doing great? Or where are you at? That they'll associate to the voice as something that tethering them. And then what their experience will turn into just a trippy experience to, I am having some sort of journey and this person is tracking it with me and I can dialogue with this person and that tethers. So where the somatic tether can get more powerful is if they're afraid. So if they're scared and you're saying, I'm here, you can do it with your voice. You get in closer and you're like, I'm right here with you. You're doing fine. You're safe. I'm here. You can do it with your voice. But a lot of people, this is what feels like they tether them back into and like, oh, okay. Because the fear is usually associated with the fact that you're like zooming out of control somehow, right? Or various iterations of that kind of a thing. So this tether factor also comes up with touch, voice and touch, your presence, period. But touch is a big part of your presence. It's a more intense way of reminding them of your presence than your voice.
Well, and I also wanted to add the same works in reverse. Like, for me, I've done many, many, many CAP sessions now. And in the beginning, it was a lot easier for me to be fully present because it was new. And the same thing goes in reverse. If you sit for too long silently and you are not connected to the client, either through your voice or through touch, it is also harder for you to be present. And so, it's for the client, but there is also something about keeping yourself tethered to them that I think is really valuable to just kind of be aware of.
Yes, ma'am.
Yeah, I wanted to have a moment of like, I work a lot with young men at the VA. And there's a tendency for them to say, no, good. It's just there's I'm noticing a pattern that they are more likely to not even want to engage in a discussion about touch. And, that could be because, I'm who I am, but I'm wondering, the way I left it is, hey, that's totally fine. If at some point you feel like you want to revisit this or renegotiate this, I'm here for that. But it also feels like it feels awkward for me to ask hey, is this something you want to revisit? It feels like they should be the one in the conversation.
Yeah, and these are vets, right? You're working with? Yeah. So this is kind of relevant for Rick and Jake's population too, in a way. And for a lot of us are going to see clients that, well, okay, so there's a couple tricks. I mean, some of this may not be actually what you're asking, but one thing that's actually interesting is that the word touch itself is kind of a tricky word. Mm-hmm. And a lot of times with guys, I don't actually use the word touch, which is, even though that's how we're teaching it to you guys. So I'm kind of glad you asked this. Like with really stoic men, or I may say something like, sometimes I'll say, hey, can I put my hand here for a second? This is in the preparation conversation. And I'll say, can I put my hand here for a second on your shoulder? And I'll say, sometimes when we're in the like if you're going through something that's kind of intense, I may support you by doing this. Is that okay? So I've just said that without using the word touch, which sounds touchy-feely. And also, I don't know. So I don't know. These are like subtle language things, but sometimes I just avoid touch and say, can I support you by putting my hand here? And it tends to be a little firmer and not like, so I'll say support you this way instead. But this gets into the one thing that this raises that I was going to comment on already is none of you have asked the sort of question, which is what happens if they don't want touch, and then when they get in the session, they do, because they go into, say, a younger part. So you have this stoic guy and he's like, no, I'm not into that. And then under session, he turns into like a scared 6-year-old boy who clearly is afraid and needs some sort of like reassurance or something, right? And then that that's what you should do, but you've contracted not to. Different people in the psychedelic profession and Sandy and I's kind of world fall differently on that. There are some people who will say, in that moment, I would kind of break the agreed contract. I teach not to, because I just feel like that's a slippery slope. But there are people who disagree with me who are really good people. So you can sit with your own sort of ethics around that. I think if you're going to err on the side of caution, you would say, okay, so we won't use touch. And then you just don't use touch with those guys. And what will happen is if in a session it comes up that they could have used it and you didn't do it, then in integration, you need to kind of like bring it up and be like, hey, there was that one part where you were remembering being 6 years old and all that. And sometimes it's really helpful. Like think about a 6-year-old kid. It's helpful to have support, like someone supporting you when you're 6. And so if that happens again next time, what if we just did this or something? You can do it that way. There are also ways of using touch without touching. So this is techniques for people who say they don't want to be touched, which is not most of my clients, but probably sounds like most of yours. So one of those is like literally like so you can do things like have the blanket over them. You do this with consent. You say, okay, we're not touching you, but I'm going to, I wish I had a video of this because I use this one fairly often. You have the blanket that's on them anyway. It helps to have 2 people, but even with one person and without touching them, you just put you pull the blanket down to the sides of them really hard. Basically what you're doing is putting pressure on their whole body with the blanket. And then you're cueing them with your words to say that like, this blanket is the holding of the whatever, like say, it depends on what you're working with. Say you're working with the trauma memory of like an abandonment. So you'd say, this is the blanket of like this blanket on you is the touch of me supporting you. You kind of plant that in verbally. So this may be getting a little more advanced for this course, but that's a way that you can do it. And I can maybe demo that at some point. And I also use visualization where I will say, visualize that I'm holding your hand. The imagination can do a ton. So I'll say like, I'm not going to hold your hand, but I'm sitting, I will usually get in, if you're in the session and they need touch and you've contracted not to do it, usually I scoot up a lot closer. So I'm talking to them from a few inches away. I get really close to them, like face to face in a way. So I'm talking really like into their ears and I'm saying, I want you to imagine that I'm holding your hand, or it could be the other, like that your father is holding your hand or that your mother is holding your hand. And so they know it's imagination, but it gives them permission to visualize it. And then I will say, tell me when you feel it. Because, they have a huge capacity to manifest like a sense experience in the psychedelic state. And they will often say, yeah, I feel it. And then what you've just done is allow them to feel touched without you actually literally touching them. So that works under the medicine. It's hard to explain in preparation, but I've done both those things, and then I haven't violated my agreement that I wouldn't touch them. And then usually, of course, in integration, you want to be like, hey, that whole thing happened. What do we want to do if it happens again? Kind of thing.
That's also one of the advantages of doing a series. I mentioned I typically don't do less than 3, and I think Yale has also moved in that direction with a new client. And so in a series, somebody might say that they don't want touch in the beginning, and then you can revisit it. Another thing that I do that is important to note is, again, it's extremely different. Like my phrase is they're meat and fruit. Like it's extremely different to just do, medicine alone versus a bunch of preparation, a solid relationship, teaching and working with consent around touch prior to the medicine than just suddenly putting hands on in the medicine when you don't have all that. And the third piece is that, it's also okay if you're just like, I think, and this again, Signi said, whatever your kind of ethics are around this, and knowing your client is important. If you have, boundary violations around touch, you probably wouldn't want to do this. But, if you're sitting there and the person, just really, you're like, I'm really feeling like I, really want to put my hand on your arm right now in order to blank, or I'll have somebody put their own hand on their heart. And then I'll say, is it okay with you if I put mine on top of yours? Which is what I typically do the first time anyway. If you're really, if you're really transparent about it, just know that you're, it's loaded, right? Because it could also be really, really jarring and disruptive and not feel good to them. So it's loaded, but there are
those are, both of those things you said reminded me of other things to say. So I'm glad. One is never touch somebody just out of the blue, like with no context or interaction. Like if I'm doing this, I always say, I'm going to put my hand on your chest and I look for the nod, or, because that will scare people. And also you could re-traumatize something that you don't even know that they're carrying. So I think you guys don't need to hear that, but I hadn't actually said it. But the thing Sandy said about letting them use their own hand is actually a really good in-between technique. Like, I feel pressure in my chest, put your own hand there. And then the step up between that and you touching it is what she said, where they put their hand and you put your hand on top of their hand. So if you have someone in preparation who really doesn't want touch, and they're like, I don't want you to touch me, you can introduce that as an option. You'd be like, well, if something comes up where I feel like a somatic intervention would help, what if I just cue you or invite you to put your own hand on your chest? And then if I put mine on top of yours, how does that feel? And you can practice that in preparation too. That's kind of a buffered version. But I forgot that's a good one. I'm glad you named that. And then you can also put weight on people with various objects that aren't you. Like we have a weighted stuffed animal thing in the clinic. Like it's got one of those like weighted blankets, but it's like a big beanbaggy thing. So I mean, there you can get creative. I think one thing I just want to say again, because we have first responder and vet clients in this cohort, is maybe avoid the word touch, period. We just taught it to you as consent around touch. I would take touch out of your vocabulary, because think about the phrase, I'm going to touch you, how loaded and weird that is for all of us, right?
There's actually a lot of trigger words like that for that particular community that they just don't respond well to.
I bet. The idea of I'm going to touch you has been traumatized for most people. So when we talk, this is actually something that we should say more often. And I might even change that video a little to include this. Consent around touch is a term that, like a therapist to therapist term. Like we're teaching you guys, hey, consent around touch. But really, I don't talk to clients that way. I don't necessarily say, we're going to talk about consent around touch now. Maybe if it's a woman or the vibe or the rapport is there, I will. But for someone where that whole term is loaded, I would substitute talking about like somatic support, language it that way, and avoid, and then if you're working with anyone who has trauma, which is everyone, so be aware, but obviously there's degrees of this. Anything closer into the core of the body is more vulnerable. So the exception is holding hands is vulnerable because that's associated with intimacy. But so don't hold hands unless that's a really clearly contracted thing. Don't just go to that necessarily, unless intimacy is what is wanted in that way. But so touching here is less vulnerable than touching here, which is less vulnerable than touching here. And here you're getting more vulnerable, right? And then the abdomen is really vulnerable. So in general, like, especially if someone who doesn't want to touch like a guy, like, I don't know, I'll ask the guys here, but it's usually something like supporting you by this, or just like putting a hand on your back or something like that. And then you might want to call it somatic support. Thoughts?
Yeah, just sharing a personal experience from the retreat in June. When I felt that I was about to come to a moment where I needed support, Madod and who else was there? Was it Mike? I forget his name.
Was it Dave?
Brian.
That's Brian.
It was Brian. Brian came over and, put about 30 pounds of pressure on my chest, and Madod grabbed my hand, and it was something that I needed. That right there is something that I needed because, and I've had a lot of time to think about this. I think it has a lot to do with, being a veteran. There's that like kind of brotherhood, camaraderie, like I'm going to help you, feeling. And that brought me right back to that feeling. And, I do that a lot with specifically my cops. Man, I really only see cops in my practice. And it's huge for them. I can tell. And they expect
hand to hand, like,
oh yeah. They expect it. Yeah. So it's kind of that, when I think about doing this for other men and even for some of the women that I see too, there's a lot that's there. I think there's a big invitation, especially if you introduce that early on into the connection you have with that client, to bring that up. Like, hey, I wonder if this would be helpful for you if things get kind of dark or maybe challenging during your experience.
That's a good way to say it. Like, what if we just, yeah. Like, so this is I love that you're saying this, because this is a great example of know your clients, like know your population. And you guys do that already, and know your population. So you would know how to language this better than I would with your kind of clients. And it's also a reminder that there's so much talk in the therapy community and in the broader culture about touch as trauma, right? We're in this big moment in our culture around how we traumatize each other with touch, especially around sexual touch. And so, right. So I think that we have collectively been overly scared off of it. Like we've almost been discouraged from using it in the profession to our detriment of our clients. And I think what you just said is a great example of like the value of human touch if it's done in an ethical and intentionally held way. And I think a lot of therapists have kind of been enculturated out of doing it because it's this idea that it's always harmful, when actually often it's not at all. So yeah, I'm very glad you shared that example of Brian and Madod, because you just said Madod was holding your hand in that, like, vet to vet way. I know I'm just using that as an example, but that, like, comrade in arms kind of energy, not like oh, you poor thing, you need help. It's more like we've got each other as guys kind of energy. I'm guessing I'm a woman, but I'm naming it from the outside. And you also said Brian put about 30 pounds of pressure on your chest, right? So like the example you described of when you were at retreat and you said 30 pounds of pressure, do you think it would have been different if Brian had just sort of rested his hand lightly?
Yeah, probably.
So like the pressure, like I know it's hard to put, like, what do you think the difference made of having all the pressure, like that amount of pressure, with that amount of force?
It was the way it was delivered. It was so like it was like direct pressure on an open wound.
Yeah.
Like I'm going to keep the red blood. I'm going to keep that bright red blood inside of you.
Mm-hmm.
That's what it kind of felt like. And that's the pressure you do put on those wounds. You put 30 or more pounds of pressure on those wounds. And so I think if he had just come up and been like, hey, sweetie, I'm like, get that off a minute. But I don't know. You never know. We'll have to do.
Well, no, but I appreciate the opportunity to ask you, because this is kind of what we're saying about pressure matters, and don't be afraid of it.
Right.
Don't be afraid of it. Sometimes what the body needs is like this very hard, intense response to be met. the teaching is that the intensity of what you're carrying has to be matched by the intensity of the response. Or if there's a mismatch, it won't work. Like if you're carrying something really intense and someone's just like this, it's like it won't, right? You have to know that they can push back against it. So there's a lot that could be said on this, and it's super fascinating. And I encourage all of you guys to ask about it in your mentoring times, or just we can talk more about it in future gatherings as things come up. I do want to take about 5 minutes real quick to talk about a few other content pieces, and then we want to move into kind of closing. So thanks for listening, everyone. A lot to ponder in that short excerpt from a typical Living Medicine Institute training cohort. If you're interested in this kind of teaching or training programs, feel free to reach out. We run a lot of cohorts. And if you're someone who's just listening in to pick up tidbits or useful pieces that you can use in your own CAT practice, I hope this was valuable for you and gave you some things to think about. Like I said in the beginning, we'll be continuing this kind of conversation. I'll see you next time. Thanks for listening to Living Medicine. We'll see you again next time. Be sure to click subscribe to get future episodes.